Hello guys, welcome to this session of ENT. So it's finally time to talk about the recall questions of ENT. Of NEET PG, right? Obviously you understand that the questions are framed based on your feedback. So all the images, all the choices, all the questions may not be absolutely correct, but whatever we could get from you guys to best of our ability, we have tried to frame the questions accordingly. Now I've got 10 questions of ENT, few image based, and although in all of them I could not get all the choices, some I've gotten, some I, according to whatever the question was, I try to frame choices on my behalf. The good news is that most of these questions were from the eGurukul. So, guys, I'm doing this session from a hotel outside of my state because I'm traveling for lecture, and because of that, I'm taking this session from a hotel. And you all know in hotels the connection, the Wi-Fi signals are not very strong. So please pardon me for that. You might have some problem in between. So you all know that type 1 tympanoplasty So in type 1 tympanoplasty, the graph is placed over the malleus, this one. So this will be type 1, this will be type 2, this will be type 3, and this will be type 4. Right? In type 1 it is on the head of malleus, type 2 it is on the incus, type 3 on the stapees, type 4 on the round window. So A becomes the correct answer. A is matching with answer A is matching with 4, B is matching with 1, C is matching with third one, and D is matching with the second one, as I've written in this column. And this is from the eGurukul app, that book that we provided PDF file, where you can see that tympanoplasty has been discussed very properly in the eGurukul app. If OAE is not available, which other screening test can be done? Now there are a lot of screening tests that can be done. Most of the tests are related to audiometry, and because they have to be, they're subjective type of investigations. You all know audiometry is a subjective investigation, and they have to be done in children, especially because screening hearing tests are mainly done in children, and therefore they outdated tests, most of them that are given in the choices. But if these were the 4 choices, Bera, tympanometry, audiometry, tuning fork, these are These three are not used for screening test. So out of this, only Bera could be a correct answer if Bera was in the choices. There was another question of the similar type. I think one was in paper 1, one was in paper 2. The slight difference in the two questions. This one says that which test will you combine when OA is absent in the patient? Again, in this case, the best investigation is again Bera, but I'm told that Bera was not given in the choices. So if Bera is not given in the choices in this question, audiometry and tympanometry has no value as far as screening is concerned. Both these tests, field audiometry as well as speech audiometry, can be done. Both can be done for screening test, and therefore D will become the correct answer out of this. Because D says either 3 or 4. 3 is free field audiometry and D says speech audiometry. So these are the two correct answers. So the point is that if you have to combine for screening test with OAE, when the OAE is not available or it is negative, then either the best test is Bera, because Bera is a electrophysiological test. It's an advanced form of investigations. But if Bera is not given the choices, then field audiometry, speech audiometry, behavioral audiometry is not given the choices. Behavioral audiometry can also be done in this patient. Right. And this is a slide from the PDF file of eGurukul, just trying to show that this topic was discussed very in details, everything, all these audiometries and free field audiometry, behavioral audiometry, everything has been discussed in details in the eGurukul app. So those who have done this one will have no problem answering these questions. I'm going a little file because I want to finish it off, because there is an internet problem in this hotel I'm taking it from. Then we go to the next question, which is question number 4, which is all of the following are smell perception test except. The 4 choices are smell dictates, Upsit test, cross-culture smell identification, and saccharide test, or saccharine test is actually, saccharide लिखा हुआ saccharine test होता है. Now the first 3, if you see the name, in the first one the name smell is there, in the second the name smell is there, here this S stands for smell. So all these are smell test, smell identification test. Saccharine test is not a smell identification test. Saccharine test is for mucociliary clearance. It is done for mucociliary clearance. That means you all know in the nasal cavity there is a mucociliary motility, ciliary motility that clears the mucus collection in the nose. So how fast the nose clears, is it normal or not? To check that, basically the ciliary motility in the nasal cavity is normal or not. To check that, we do saccharine test. Saccharine is a type of carbohydrates, saccharides. So you place it in the anterior part of the nose, and this will dissolve in the nasal mucosa or mucus, and it will travel through the nose to the behind the nose, which is nasopharynx. And when it goes into the nasopharynx, the patient gets the taste of that saccharine, and the patient knows now that the saccharine has traveled through the nasal cavity. So we note the time when you place the saccharine in the nasal cavity and when the patient gets the taste of that. So we note the time. Up to 25 minutes it's normal clearance time. If it is more than 25, that means it has taken more time. So it is not a smell test. It is a test for mucociliary clearance. The rest of the three are smell tests. So D is the correct answer because except was the MCQ. So if you see this slide, the first one is smell dictates test. It is as application of 8 different odorants are used, and there is a questionnaire. The patient has to fill up that questionnaire, and based on that we know whether the patient is having identification of the smell or not. Can he identify different types of smell? And this is that particular, these are called the dictates, the small, the 8 different kind of smells. The patient has to smell each of them and then identify the smell, and then we know whether the patient can identify the smell or not. It's a very similar kind of test, UPSIT. UPSIT stands for University of Pennsylvania Smell Identification Test. It's a very similar test. It's a commercially available test. Again, it's for smell identification. And this cross-culture smell identification test, it has 12 item version test. In the first one there was 8, there are 12 in this one. So basically these tests, only the names could be important. They are all used for identification of the smell, whether the patient can identify the different smells or not. But saccharine test is not for smell identification, it's for mucociliary clearance. That's the main aim. Right. The fifth question we have in our armory is this one. There was a sagittal section of a cadaver, this area, the nose and sinuses, and there was a pointer at this structure, which is the sphenoid sinus. And they'd asked that this particular structure which is pointed at opens in which of the following meatus? Does it open the sphenoethmoidal recess, superior meatus, middle meatus, or the inferior meatus? Now this is a sphenoid sinus, and sphenoid sinus opens in the supreme meatus, which is also called the sphenoethmoidal recess. We all know that in the supreme meatus, which is the sphenoethmoidal, in the middle meatus, they are opening of 3 sinus osteas. Which are the 3 sinus osteas that open in the middle meatus? Maxillary sinus, frontal sinus, and antiethmoidal sinus. Now these are the 5 sinuses and the osteas. So all 5 done. Sphenoid in the supreme, which is sphenoethmoidal recess, postethmoid in the superior, maxillary, frontal, and antiethmoidal in the middle meatus. That means inferior meatus has no sinus ostia. So what happens in the inferior meatus? We all know NLD. What is NLD? Nasolacrimal duct. So nasolacrimal duct opens in the inferior meatus. And we all know from our class that this is a very, very important topic. I keep telling you that in the anatomy of the nose, the most important part is the lateral wall of the nose. Lateral wall anatomy is the most important anatomy, and lo and behold, we have a question from the lateral wall of the nose. And nasolacrimal duct, I keep telling there are a few other points about the nasolacrimal duct that one should know, like the direction where it opens, the diseases of the nasolacrimal, like cyst formation, nasolabial cyst, and it can block, it can cause necrocystitis. Again, this can be discussed in eGurukul app in details properly. Now the problem with this question is, the problem with what I have received is this, that actually all these conditions can cause septal perforation and deformity. But the most dreadful disease of the lot, the most aggressive disease of the lot that can cause nasal deformity and septal perforation of this is the last one, NK lymphoma, T-cell lymphoma, or non-healing lymphoma. All the 3 names are accepted, like I said. So out of the lot, this is the best answer. Now the first one, Wagner's granulomatosis, as the name tells you, it forms granuloma in the nasal cavity. It's a vasculitis, type of vasculitis that causes granuloma in the nasal cavity. So the destruction of the nasal septum and the deformity of the nose is very limited and at a very late stage, often doesn't happen. Before it's too late, the patient gets treated. Syphilis, the tertiary syphilis. Syphilis can be congenital, primary, secondary, tertiary. Tertiary syphilis may cause septal perforation, and if the perforation is very large, it may cause deformity like saddle nose. But for saddle nose, the deformity has to be the septal perforation has to be really very big, and it happens at a very late stage, like I said, tertiary stage. So most of the patient never reaches that stage because they get treated in the meanwhile. That's why in most cases, syphilis cannot cause a deformity of the nose. May cause septal perforation, but deformity is usually not seen. The same is true for tuberculosis also. Tuberculosis is even less severe as far as nose damage is concerned than even syphilis. Syphilis is even more aggressive than tuberculosis. So tuberculosis will hardly ever cause the septal perforation or deformity, but possibility is always there. But natural killer cell lymphoma or T cell lymphoma, the last one, will almost always cause septal perforation and deformity. One of the other name for this disease is, it's also called midline non-healing lymphoma. Midline, so it damages the midline of the nose, middle of the nose, which is septum and the nasal bridge. So out of this lot, the D is the best answer. But like I said, all the four are possible causes of deformity and nasal septal perforation, but best answer is the last one. Right? Again, most of the disease of the nose has been discussed in our app. Then we go to the 7th question. Foreign body entry in the larynx inlet, prevented by the cough reflex. Reflex is sluggish in alcoholic ingestion and other conditions. Which nerve is likely to be injured or damaged? Basically, a foreign body has got stuck in the inlet of the larynx and the cough reflex is absent. So what is the cause of this? Which nerve damage? Is it external laryngeal nerve, ELN, internal laryngeal nerve, ILN, recurrent laryngeal nerve, or glossopharyngeal nerve? Now glossopharyngeal nerve is out of question because glossopharyngeal has nothing to do with larynx. Glossopharyngeal supplies the oropharynx, isn't it? And the damage of the glossopharyngeal may cause gag reflex absent, but it never damage the branches of the nerve that supplies the larynx. So it has to be one of the three nerves, either external laryngeal, internal laryngeal, or recurrent. Now cough reflex is a reflex. And like any other reflex, this will have an afferent nerve and an efferent. The foreign body has got into the laryngeal inlet because of aspiration. Now if I ask what is the main function of the larynx, the main function of the larynx is the prevention of the aspiration, right? So how does it prevent aspiration? Because the moment you swallow something, the larynx will sense that food is coming, something is coming in the larynx, so it has to avoid or prevent that by closing the larynx. So Arishab, so like I was saying, even if it is superior was given in the choices, still internal is the best answer because like I said, superior laryngeal nerve lies outside the larynx, and so the disease of the larynx, the problem in the larynx cannot damage the superior laryngeal nerve. So if you have an absence of the cough reflex and there is aspiration, the most common nerve that causes this is the internal laryngeal nerve. And rest of the nerve, like external, is a purely motor nerve. External is a pure motor nerve. It supplies a muscle, cricothyroid muscle, and that's why damage to this nerve will have no sensory implication. Recurrent laryngeal nerve is mainly a motor nerve, but it supplies sensory also. This supplies sensory to the subglottis. Now subglottis sensory has nothing to do with aspiration or cough reflex, isn't it? You understand this? It's below the glottis. That's why this was not a difficult question in my opinion. It was a very simple question. Internal laryngeal nerve is the one that is damaged, causing this condition. And laryngeal anatomy, especially nerves of the larynx, has been discussed in great details. And this is that slide or pic from this PDF file of the eGurukul apps talking about the nerves that we discussed in the larynx. Next question, question number 8. Jugular foramen is damaged. This leads to, again I don't have the proper choices, but it says loss of taste sensation on the anterior two-third of the tongue, loss of taste sensation on the posterior one-third of the tongue, loss of sensory from anterior two-third of the tongue, and loss of taste and sensory from the anterior two-third of the tongue. Now, jugular fossa, what is the main structure that passes from the jugular fossa? Jugular fossa, the main structure that passes from here are a jugular vein, obviously, jugular vein, and 3 nerves. We all know which are the 3 nerves from the jugular fossa: 9th, 10th, 11th. Right. So if there is a damage of the jugular fossa or the tumor or whatever, one of these 3 nerves will be damaged or any combination of the 3. Now, out of the 3 nerves, the only nerve that supplies the tongue, whether anterior two-third or posterior, anything in the tongue, is the 9th nerve. So if there is anything to do, it has to be the 9th nerve. So 9th nerve supplies which part of the tongue? 9th nerve supplies posterior one-third of tongue, isn't it? I'm sure you know this. And what does it supply in the posterior one-third of tongue? 9th nerve supplies taste as well as sensory of the tongue. Taste plus sensory of the tongue are supplied by the 9th nerve. So whatever is given in the posterior one-third of the tongue can be affected when the jugular fossa is damaged. Anterior two-third of the tongue is not supplied by the 9th nerve. So when I draw the tongue like this, let's say the third of the tongue, the taste is carried by chorda tympani, I'm sure you know. And chorda tympani is a branch of facial nerve, isn't it? And facial nerve is nowhere close to the jugular fossa, nowhere close, so it cannot be affected. The sensory of the anterior two-third is supplied by lingual nerve. Lingual is a branch of mandibular division of trigeminal, V3. And again, trigeminal or any branch of trigeminal is nowhere close to the jugular fossa. So these 2 nerves cannot be damaged in the jugular fossa problems. Therefore, anterior two-third will have no problem. Posterior one-third, like I said, both taste as well as sensory is carried by the 9th nerve. There is no 10th or 11th nerve in this part of the tongue, anterior two-third or posterior one-third. So 10th or 11th cannot be affected. So what it means is that in this case, 9th nerve is damaged, causing problem in the tongue. And like I said, 9th nerve damaging, causing problem in the tongue could be either taste gone in the posterior one-third or sensory gone in posterior one-third or both. So do you have any of this in the choices? Let's see. Loss of taste on the anterior two-third of the tongue, not possible. Loss of sensory on the posterior one-third of the tongue, possible. Loss of sensory from the anterior two-third of the tongue, not possible. Loss of taste and sensory on the anterior two-third of the tongue, not possible. Therefore, the only possibility is B. So B is your correct answer in this case. If these are the choices or similar choices, but you understand, even if the choices were slightly different, you understand that if a jugular fossa has a problem and that causes any problem in the tongue anterior two-third or posterior one-third, it is only possible because of 9th nerve, and 9th nerve supplies the posterior one-third of the tongue. So this part of the tongue will have a problem. It will have both the problem sensory as well as taste problem. Anterior two-third of the tongue will have no problem in this patient because anterior two-third is either supplied by facial or trigeminal, a branch of trigeminal, which are not near the jugular fossa. Is it clear? Right. And again, this part has been discussed in the eGurukul app. This is that slide showing the same thing. Next, we talk about there is an audiometry diagram. So I keep telling you in the class that audiometry is a very, very important thing, and the diagram of audiogram can be expected in your exam. And this can be expected, similar question can be expected in NEET PG as well. So audiometry, tympanometry, tuning fork, these are the questions that you must do very, very well. Now, a patient is not able to hear properly from the left ear. Given diagram, audiogram will, there is a given audiogram finding. So what will be the Rennie's and the Weber's finding in this patient? So what you see in this audiogram is, see, the red line is showing right ear, red line is showing right, red is for right ear, and the blue one is for left ear, isn't it? L for left ear. Now if you see the red one, both AC and BC are overlapping, and this is your 25 mark. Where is the 25 mark in this audiogram? This is the 25 mark roughly. So right, both AC and BC are within the normal range, above the 25 mark. So right is absolutely normal. But the left ear, the blue one, both AC and BC are below 25, as you can see, and they are nearly overlapping. When they are overlapping means the gap is very little, AV gap is hardly there. So this is a criteria for sensory neural hearing loss. What is the criteria for sensory neural hearing loss? That both AC and BC must be below the 25 mark in this case, and the gap between the two must be less than 15 decibel. So because they are both overlapping, the gap is nearly zero. So this is a criteria for sensory neural. So right is normal and left is SNSL. This is a very simple diagnosis, I'm sure you know. Now Rennie's in normal is positive, and Weber's, if both are normal, you usually centralize. If both are normal. In SNHL, again Rennie's is positive, it is false positive this time, and Weber's will go to the opposite side. So if it is left ear SNHL, the Weber's will go to the opposite side. So Rennie's will be positive in both the ears, and Weber's will go to the right ear because it has to go opposite of the left side, right ear. So this is the finding. Rennie's is positive in both the ears, and Weber's will go to the right ear. That should be the finding. So let's see, you have this combination anywhere in this question or not. So the first one says left Rennie's negative is not possible. So any Rennie's negative is straight away out. The rest of the three says negative, Rennie's is positive. So Rennie's can be positive in the right ear as well as positive in the left ear. So all these positives are possible. But the Weber's has to go to the right ear. So Weber's is going to the right ear in the last one. Right? So this is your correct answer, because right ear Rennie's positive it says, but left ear also Rennie's is positive. It's not given in the choices in this case, but right and left ear both will have Rennie's positive. So both are accepted. But here, more importantly, the Weber's will tell you the correct answer, because Weber's will go to the opposite of the left side. Opposite of the left side is the right side. So Weber's has to go to the right side. So D is your correct answer. Rennie's is positive on the right side. Weber's will lateralis to the right side. And if there is a choice saying Rennie's is positive in the left ear and Weber's is lateralis to the right side, that is also correct answer. But that is not given in the choices. Okay, if it says Rennie's is positive in the left ear and Weber's is lateralis to the right side, that is also a correct answer. If it was given, that is also correct answer. So both are correct answer. So one of the two will be given in your question paper. Right? And tuning fork as well as audiometry is discussed in great details. Almost both together in your eGurukul app must be nearly 1.5 hour topic. It's so important. So first I tell you the basics of AC, BC, CHL, SNHL, and then we build on that. So it's nearly 1.5 to 2 hours topic, these two together. So obviously it's a very, very important topic. And this is that slide showing you one of the images from the PDF file of the eGurukul app. And then question number 10, again it was hearing test. So this tells us hearing test is such an important test. We have two questions from the hearing test, tuning fork, audiometry, and this one is also tympanometry, including tympanometry also. So this says a child presented with hearing loss. On examination there was high arched palate with crowding of the upper teeth. Tympanometry was done and the image of the tympanogram is shown. Which of the following surgeries may be required in this patient? So now you have to know the surgery. So this question entertains many things. It entertains a child with hearing loss, tympanometry, and the surgeries. So a lot of things. Now, when the patient has high arched palate, with crowding of the upper teeth, this tells me this is a patient of adenoid facies, isn't it? This is a feature of adenoid facies, which is due to adenoid hypertrophy. So this is a case of adenoid hypertrophy which leads to adenoid facies. Now I compare to this slide. Adenoid hypertrophy, I'm sure you know, can lead to two problems. It may block the quena or nose, and this leads to adenoid facies. So obviously in this patient, this quena or the nose was blocked because of adenoid hypertrophy, and that's why the patient has adenoid facies, high arch palate, crowding of whatever was given in the choices. The second thing the adenoid hypertrophy can do is it will block station tube. This causes glue ear, causing hearing loss. These are the two things that adenoid hypertrophy. And as you can see, the patient has both the problems that can happen to the adenoid hypertrophy. It is blocked quena or nose leading to adenoid facies, plus blocked station tube leading to glue ear causing hearing loss. And this tympanogram is called B-type tympanogram. Flat is also called flat tympanogram. When you get flat or B-type tympanogram, you get in glue ear. So this tympanogram proves that the patient is having glue ear. So we know the patient has glue ear because of two things. A, because the patient is having hearing loss, and B, the tympanogram is showing you flat or B-type tympanogram. We know the patient has adenoid facies because of that finding which is described in this question, high arch palate with crowding of the upper teeth. So both are done. See. So what is the treatment for glue ear? The treatment for glue ear is myringotomy with grommet, and for adenoid hypertrophy, obviously you will have to do adenoidectomy. So any question which has a combination of grommet and adenoidectomy is a correct answer or correct surgery. So the third one, C, is exactly this choice. It says we'll do grommet insertion with adenoidectomy surgery. And this is the correct answer. C is the correct answer. Adenoidectomy with grommet insertion. And if you remember, if you have attended any of the lecture or the apps, eGurukul app, I always tell you, out of all the types of otitis media, ASM, glue ear, CSM, safe, unsafe, tubercular otitis media, glue ear is the most important type of otitis media they ask you questions from. And again, we have the question from glue ear. This is what I tell you in the class, and this is what you have got. And I tell you, tympanometry is another important topic. And I've discussed this a similar question in the T&D session also. In the T&D session, we have done very similar question. So all this has been discussed whether in the class, in T&D, in app. So I'm pretty sure that if you have read this or attended these sessions, you will have no problem answering this question. So the good news is that almost all questions of this INI-CET exam were from the classes, notes or T&D or eGurukul, whatever you have done, you will have been able to answer all these questions. So these are the questions that I've been able to get from you guys. I have no other questions. So if you have any other additional question which I did not get or missed, you can always contact us. And if you get any new questions, we will always discuss it in future. So I hope that this session, the exam that you have attended yesterday, has gone very well. We really hope that you guys get the rank of your choice and the subject of your choice, because clearing INI-CET exam is a huge, the best thing that can happen to a medical student, isn't it? So hope that you do it. If not, you still have NEET PG coming up few months from now. So don't stop your preparation. Keep preparing for NEET PG, because that has more number of seats. The chance of getting there is higher. We all know this. In fact, most of us are preparing for NEET PG exam, isn't it? So keep preparing. Anything that you need from us, we are always here to help you. Till then, take a very good care of yourselves. God bless you. All the best in future. Ciao. I finished this session a little fast because the internet was a problem. Otherwise, I would have discussed it in more details. Okay. So best luck, guys. See you again.